Going into surgery at 5 months, we were aware that she had about a 50-50 chance, to live, but if we didn't do anything, it was just a matter of time before her heart would give out and she would die.
Having worked at some of the top children's hospitals in the country and the top heart programs, coming to CHOC it's a smaller program. There's even more personal attention paid to parents and patients. The amount of detail and attention you need to pay for every little aspect of care is just magnified when you take care of especially a very small baby.
This is the place that saved her life. I really believe if she hadn't been here at this, this world-class facility, she would have died.
Pediatric intensive care as a specialty developed within the last 25 years. One of the most important features of what we do is that we are available 24 hours, 7 days a week to transport children to CHOC from outlying emergency rooms, offices, or other facilities. The care at children's hospitals is more expensive. We have a wide variety of people who are required to take care of the children, ranging from the physician and nursing team to respiratory therapists, nutritionists, and pharmacists, just to name a few. Every one of these people is specifically trained to take care of children.
At CHOC, we see in an average year about 150 to 160 new cases of cancer, which actually is quite a large percentage. I think CHOC is predominant in our county. We see about 80% of the cases that would be diagnosed.
The first time we came here, we really thought we were living somebody else's life, that it couldn't possibly be us.
Probably the first 12 to 24 hours, you don't hear a whole lot of what anybody says to you.
Sammy had just gotten over an infection and showed us some swelling right under her left ear. After 3 weeks and 3 different antibiotics, the family practice said there's something going on here, and they actually recommended us to come to CHOC. So we went from basically Wednesday night being at cheer practice to having had an outpatient biopsy on Thursday and a surgical biopsy on Friday morning, flip of a switch.
I knew I couldn't tell her. I didn't know how to. The child life counselors who came and told her, "Do you know the word cancer?" And Sammy goes, "Oh, I know what cancer is, but I don't have that." And Bree was like, "No, honey, you do."
Well, they're gonna give me a medicine chemo, but I have to take other medicines with the chemo. It's made to kill bad cells, but it also kills some good cells.
But she kind of understood basically what it truly was at the time, and that there's strong medicine that can help.
The good news today about children who have cancer is that we are curing more of these children. And if you look as a whole, we probably around about 65 to 70% of all kids are cured of their cancers.
I couldn't imagine doing this, and I almost feel worried about kids in other parts of the country that maybe don't have a children's hospital.
Mason came in with a very large growth on the part of the brain called the cerebellum.
He said, "I know we've never met before, but I got bad news for you. Your son has a brain tumor." And he says, "Well, it's very serious. And does he need surgery?" "Yes, he's going to need surgery." "When?" He said, "Well, today or tomorrow." How could it be so fast? He's a normal little kid running around. How could we do that fast?
He's a wonderful success story. We don't know exactly what a tumor is until we take a piece of it out. Unfortunately, he had a tumor that if you surgically take it all out, there's a very high % chance of being cured. And he had one of these types that surgery, more than chemotherapy or radiation, is curative. And this is the end result. We have a very healthy boy that's going to lead a normal lifestyle.
And CHOC treats anybody that comes in here, whether they can afford to pay or whether they can't. That's really special about CHOC. So it isn't only people with money or insurance that get treated. If a child needs care, CHOC will treat the child. That's pretty special.